Hello viewers, welcome back to my channel. In today's video, we will discuss one of the commonly asked questions in SDTM, that is the difference between adverse event and clinical event. So let's begin. Let's first understand what is a AE domain and what it captures. AE stands for the adverse events and captures any negative or untoward medical incidents that happen after the subject receives the study drug, even if not directly linked to the drug. It also mentioned whether the adverse event is serious or not serious, if there is any relationship to the study treatment drug or not. Now, if we talk about what is the CE domain, which is the clinical event, it captures the protocol specified events that are important for evaluating the drug. These events are expected or monitored, not necessarily unexpected like AE. The focus here is that these events are expected. So now let's understand the difference between these two domains with of an example. Suppose a subject suffers a heart attack during a cardiovascular clinical trial. If this event is reported in an adverse event form, it goes into the ACE domain, that is standard for safety monitoring. Now, if the protocol specifies that myocardial infarction is a key clinical event to track, regardless of whether it is adverse or not, then this event also goes in the CE domain. In some cases, some events may be recorded in both AE and CE. In that case, the programmer must ensure consistency in the date, event term, and seriousness flags across both domains. Few other examples of which shows the distinction between the AE and CE domains are like in a diabetes drug trial, things like high blood sugar are expected and tracked as clinical events because they are part of how the disease behaves. But if the patient develops a rash, feels nauseous, or vomits, these are like adverse events caused by the drug. We carefully record those to make sure the medication is safe. Another example is of the asthma drug trial, where the shortness of breath or wheezing are the expected symptoms that can fluctuate with asthma severity and hence will be considered as a clinical events. However, the swelling of the face or throat, which are unexpected allergical reactions possibly caused by the study drug, will be considered as the adverse event. Another example is from the hypertension trial, that is the high blood pressure trial. So in this case, elevated blood pressure readings are the expected fluctuations during treatment in a clinic and will be considered as a clinical event, whereas dizziness or fainting could be side effects caused by the medications lowering the blood pressure too much. So these will be considered as adverse event. Similarly, in a lowering drug trial, changes in LDL cholesterol levels will be considered as the clinical event as this is the main target that is being studied in the trial. Whereas the muscle pain or weakness is an unexpected side effect known to be linked to some cholesterol medications and will be considered as adverse event. For a migraine prevention trial, headache are considered as the expected events and will be considered as the clinical events, whereas fatigue or dizziness will be considered as the possible side effects from the preventive drug and will be considered as adverse events. So, to sum up the difference between adverse event and clinical events, we can say that in clinical trials, clinical events are expected symptoms or changes related to the disease or condition itself. Meanwhile, adverse events are unexpected or unwanted reactions that might be caused by the study drug. Recording both help researchers understand how well the treatment works and how safe it is. This brings us to the end of today's video. We covered the key difference between the AE and CE domains and walked through real examples and discussed how and when to use each domain appropriately. If you find this video helpful, don't forget to like, comment, and share. And of course, subscribe to the channel for more clinical data programming content. we have got a lot of more way coming to your way. Thanks for watching.